The directive for Edmonton emergency rooms to treat patients in hallways is over. And Alberta Health Services says it was successful in freeing up emergency services to deal with the unusually high demand. But doctors tell me the fact it was needed and needed this time of year is signs of a crisis.
Literal definition of a disaster in the medical terms of that. The demand is way outstripping our ability to supply care.
AHS says they have used similar protocols in the past and before COVID, but normally midwinter. The unseasonable spike in emergency calls is the challenge, according to Alberta's top ER doctor, Paul Parks.
If we're seeing this in August, and we're really worried that once the fall hits, this could be beyond critical, that maybe lives may be at stake.
Normally, summers are slow in the ER, without the rise in respiratory illnesses we see in fall and winter. Dr. Parks says part of the problem is a post-pandemic patient surge, not just in Alberta, but Canada-wide, often seeing patients who avoided or couldn't get care. Add to that, burnt out staff struggling after 2 years of constant work.
Faced with very high volumes of very sick, complex patients with staffing levels that are 70, 80% at best and no end in sight. And of course, now we're having COVID cases starting to rise again.
Park says there is something specific to Alberta, a hurting morale in ERs, largely due to the lack of acknowledgement of the situation from government elected officials.
Knowledge that a disaster is occurring in our healthcare system right now. If they don't do that, then nothing gets set into place to do all those short-term, medium, and long-term solutions.
City News requested an interview with Health Minister Jason Copping, but did not hear back by broadcast deadline. Meanwhile,
rather we need a new government to fix the relationship with frontline healthcare providers so we can get back to focusing on patient care.
The opposition NDP using the crisis to highlight their election campaign. Dr. Park says the most important thing for Albertans to know if they're sick or injured and in need of urgent care is to still call 911 or go to your local ER. Even though the system is strained, they're still there to treat you. Just bring an extra dose of patience. From Edmonton, Carly Robinson, City News.